Like most providers, Dr. Claire Babineau is incredibly busy. But unlike many of her peers who find themselves running from exam room to exam room, squeezing 45 minutes of service in a 10-minute window to accommodate their bottom line, she has flipped the system on its ear. She's created a system at Women's Wellness in Marietta, Georgia, that allows her to spend 45 minutes or more with her patients and still manage to keep her books balanced.
I've been practicing medicine since 1991. We've been in this location since about 2000. And we are currently doing gynecology.
I have been with the practice since '98, so that makes it 13 years. And on a daily basis, I do everything from checking patients in, out, getting pre-certifications, credentialing, whatever it takes to run a medical practice.
I am the person that's in charge of her visit. She may see the doctor, but as far as getting anything done, that responsibility falls to me.
On a daily basis, I put patients into the room. I work with the doctor on procedures, pulling charts, calling in prescriptions, triaging incoming calls from patients.
We see an average of about 10 to 12 patients a day. And with that schedule, we can spend an hour to hour and a half with each patient, sort of being very detailed with their history and physical.
Once a patient comes in, I need to have her file. And I pretty much need to document everything I do with her. So if I speak to her at 9 in the morning and I speak to her at 12 in the afternoon, I need to document that all the time. So it's grabbing, putting down, grabbing, putting down.
The paper system is all we've known. It's very cumbersome. It's time consuming.
Of course, with paper system, there comes a lot of headache.
It starts with when the patient enters the door.
With the patient call, incoming call from a triage patient, I will take down a message, I will pull the chart, have to go through the chart and write down the message that the patient left.
After the physician or the practitioner sees the patient, then we have to enter it in the chart. And then that chart is filed away depending on what's done. If a person needs further testing, that's more paperwork that has to be filled out.
Ever since I've been in this field for about 3 years, it's all I know, and up to this point it was great.
We don't lose paper records, they're misplaced, and that does happen occasionally.
You know, in the last several years, technology has changed things, and it's even seen that the paper system is outdated.
The person we work with is Lenny Swanson. He's very, very brilliant in terms of setting the protocols and trend that we needed. He actually got us, he's the one why I actually changed to the 11.1, because that was not what we were currently using was not a certified EHR system, so we upgraded. And in terms of patient load and the different carriers, he helped me to determine what portion we need to have and what would be certified and help us along the way. He's a great guide.
Her staff had been using as much of the system as they could, from checking in patients to data collection, without Dr. Babineau's full commitment. They are bubbling over with excitement as they explore how this system will revolutionize their workflow and responsibilities.
Now I've learned a better way. I'm like, yes, can we have that better way?
We're just now venturing with our practice going electronic.
It's information at your fingertip, it's accuracy, it's taking away manpower.
We're using a system, UMD, which is a web-based system.
The biggest thing with my job is accurate information.
It met our needs with respect to the gynecology.
With the introduction to EHR, I find that it gives me more options. I have an email contact, I have a fax number, I have many other ways of getting in touch with them. And the system kind of backs me up in regards to that.
You can just go into the system and actually get whatever you need without pulling a chart.
Since the doctor has to actually put the level of care in, we shouldn't miss anything. We should be on an equilibrium where, we're actually perfect.
It raises the bar really, and you can multitask to the 5th level.
I loved EMR better than the paper system at first. Using it, I couldn't get used to the EMR system at first, but as time went on, I never wanted to go back to the papers. It's too time consuming.
I don't have to spend as much time focusing on one patient. I could do 5 in 10 minutes.
In a perfect world, I know it's going to take some time. It's sort of a gradual transition. We would be pretty much paperless.
Information at your fingertip is utopia. That's a perfect world. And with the EHR system, it's going to be perfect because you don't need to be here to work. You can work from anywhere.